Continuing with our discussion of reading interventions, you may ask, how can we know if a reading program is effective? In selecting a reading program, it is important that there is actual evidence that the program improves children's reading. Is there scientific evidence that the program is effective in improving children's reading? That is the program evidence-based? You want specifics. A good place to begin to examine this issue is the U.S. Department of Education's What Works Clearinghouse. The establishment of the What Works Clearinghouse within the Institute of Educational Sciences of the Department of Education reflects an important positive development. Within medicine, the Food and Drug Administration, FDA, serves to protect the consumer by ensuring that medications and medical devices must have evidence of safety and efficacy before they are approved for sale. There is no equivalent organization in trials of potential reading interventions. Though the What Works Clearinghouse has no enforcement power, it rates evidence behind various programs and textbooks using criteria similar to the ones researchers use to assess the effectiveness of medical treatments. This represents a significant potential aid to educators and parents in selecting effective programs. Keep in mind that testimonials, no matter how moving, are not scientific evidence, nor are articles in newsletters and magazines, nor mentions in the media or online acceptable evidence. Furthermore, the term research-based is not sufficient. It simply means that the program is based on theory, and theory is not evidence or proof that a program actually works. As I noted earlier, phonemic awareness and phonics are often grouped together as alphabetics, and there is extensive scientific support for the critical role they play in early reading. While many commercially available programs contain elements of these components, few provide enough scientific evidence to meet the rigorous standards developed by What Works Clearinghouse. In the second edition of Overcoming Dyslexia, on pages 288 through 290, I have reviewed examples of programs that meet What Works Clearinghouse standards for effectiveness. You may have heard reading programs referred to generically as Orton-Gillingham, a tutorial approach developed for struggling readers over 7 decades ago by Samuel Orton, MD, a neuropsychiatrist, and 3 teachers with whom he worked, Anna Gillingham, Bessie Stillman, and Beth Slingerland. Orton-Gillingham focuses on phonemic awareness and phonics embedded with a highly structured and systematic framework. Orton-Gillingham is conceptualized as an approach with many features or principles which are included in a number of commercially available programs. The Wilson Reading System is a structured literacy program based on phonologic coding research and Orton-Gillingham principles designed for children in grades 2 and above. A new version of the Wilson Reading System, referred to as WRS-4, released in early 2018, represents a major step forward by having students begin reading connected text at the very first lesson. This represents a breakthrough for dyslexic students and places them on the path to becoming readers who not only decode well, but who read fluently and with good comprehension. The Wilson program provides students with many rules and may be especially appealing to brighter students who are highly verbal. According to What Works Clearinghouse, this system produces significant positive effects on alphabetics. This program, and indeed all other evidence-based reading programs, must be implemented as they were designed to be and should not be abbreviated, either for the time spent each day or for the duration of the program. What are the best ways for the dyslexic child to develop fluency? Fluency forms the bridge between decoding, here represented as accuracy, that is, reading a word accurately, and comprehension, understanding what you read. Children acquire fluency word by word, or word group by word group, reflecting the words they have read and fully mastered by repeated exposure if they begin pronouncing the word correctly. It isn't as if suddenly a child reads all words fluently. For some people, as few as 4 correct readings are necessary for automatic recognition of a word, while as many as 12 correct readings may be necessary for others. And while accuracy is a necessary precursor to fluency, accuracy does not necessarily evolve into fluency. This is especially true of a dyslexic child who must rely on slower, ancillary neural pathways for reading. These pathways are effective for accurate reading, but not for fluency. Fluency is a major, critical factor facilitating reading comprehension, reflecting its great importance, especially to a dyslexic child. I will emphasize once again the key factors to keep in mind when teaching fluency. These are to practice oral reading out loud, practice reading connected text over and over again, and provide ongoing feedback as the child reads. Recent research emphasizes the importance of fluent reading of connected text, in contrast to fluent reading of isolated words, as an important element in the development of reading comprehension. Reading connected text should not be delayed, for this is what reading is all about, getting to meaning. By seeing the same word in different contexts, the child realizes that the same words he sees on the page may have several specific meanings, depending on the surrounding words or paragraph. Reading connected text increases a child's vocabulary and background knowledge, 2 critical factors influencing comprehension.
Our writing curriculum is integrated with our social science curriculum, social studies curriculum. And so a lot of that would be first talking about it, using that oral language to really explore a subject. And then as you develop the language and, maybe you have enact a play about it, or you build a model of a globe or a home where, maybe you're with a Navajo Indian, or maybe you're over in Romania, and you're looking at the dress or the cuisine, then the students can have a novel to read, and they read it together and then in the class, and they also can read it at home. And then they can start writing about it as well. So it integrates it, but it starts with the oral language and helping them build a basic knowledge of the whatever the content is, rather than here's a textbook and go read 100 pages and then we'll talk about it.